made sure that nothing goes to hurt the livelihood propositions but of the BD rollers, but equally continuing with very many schemes which will give them health awareness. I'll read that out a bit to highlight, sir. When I say there's no change in the tax incidence of BD, I just want to put it on the record here so that honourable members will appreciate. In the current regime, which will continue till the end of this month because of the compensation cess, which is the scheme of things since 2017 when GST was brought in, the GST rate, as I said, on BD is 28%. And there is this NCCD, which is a calamity-based collection that we do. For handmade BDs, for every 1,000 units, we charge 1 rupee. If it is a machine-made BD, then for every 1,000 units, we charge 2 rupees and not more. Together with that, as I said, basic excise duty continued as a token gesture even during the GST regime when the compensation cess was being collected. The central excise was kept at a very nominal rate. And how nominal is nominal? 5 paisa per 1,000 units. Not 5 rupees. 5 paisa per 1,000 units, which is man-made, and 10 paisa per 1,000 units if it is machine-made. So this is what prevails currently. Exactly what prevails now is what is going to prevail after excise comes into play. So the proposed regime will have BD at 18% as recommended by the 56th GST Council. That is why when the next generation GST was announced, a lot of people said, what have you done? GST BD rate was at 28. Over and above that, there was some cess. Now, minuscule cess. But over and above that, so 28% is the rate at which BD was and continues to be till 31st. But we had to move it along with very many items because 28 is not available anymore as a rate under GST. So every item moved to 18 unless it was a sin item which went to 40. Cigarettes went to 40. BD did not go to 40. It, on the contrary, moved to 18 because there was no more 28. So from 1st January or whenever this new thing comes into play, in GST it will be at 18. So a lot of people question saying you've reduced the price because you've reduced the tax on BD. But that is because we didn't have 28, so it went to 18. The NCCD portion continues to be the same as 1 rupee for every 1,000 BDs, handmade, and 2 rupee for every BD for 1,000 units if it is machine made. That continues as it is. And the basic excise duty, where it was 5 paisa per 1,000 and 10 paisa for per 1,000 machine made, will be at 10%. Together, the incidence on BD will be the same. It shall not worsen the situation or it shall not have a negative impact on BD rollers. That's an upfront statement I want to offer. So now I come to specific points which many members have raised. I want to address them. Pramod Tiwari ji, while speaking, apparently has said that the bill is silent on tobacco farmers. And what will happen to the workers who are working in the tobacco-related, in the tobacco cultivation and so on. And also he has observed that this is against devolution. I want to first correct this impression, sir. This is an excise duty. It's not a cess. We'll talk about cess tomorrow, day after, whenever it comes. But this is an excise duty. This excise duty, by the very nature of taxable pool, will join the taxable pool and it will be devolved per the Finance Commission's recommendation to the states. It is not against devolution. It joins the taxable pool. That is one thing. Second, sir, there are several schemes from the government to take care of tobacco farmers. Now, this scheme has been on since 2015-16. It's called Crop Diversification Program, Rashtriya Krishi Vikas Yojana, and it runs in 10 states, major tobacco producing states, where farmers are encouraged to move from tobacco to other crops. I'll read out the states where this is happening: Andhra Pradesh, Bihar, Gujarat, Karnataka, Maharashtra, Odisha, Tamil Nadu, Telangana, Uttar Pradesh, and West Bengal. In all these states, has it had an impact? Yes, it has had an impact, because over 1.12 lakh acres of land has shifted from tobacco growing to other crops. And I'm talking about a period between 2017-18 to 21-22. So what are the crops to which they moved? Each state focused on its own area, but largely sugarcane, if it is an irrigated area, sugarcane, groundnut, oil palm, cotton, chili, maize, onion, pulses, and turmeric, if it is irrigated. If it's non-irrigated area, or if it is a state-specific subject, I'll read out the example of 3 states. Telangana tobacco growers moved to producing Bengal gram and chilies. Odisha, from tobacco, they moved to vegetable growing and maize. Karnataka, they moved from tobacco to soya bean and sugarcane. So, this move from tobacco growing is being encouraged, and 10 states have been given that attention through this program. As I said, more than 1.12 acres of land have moved from tobacco to other crops. Equally, are we giving any attention to BD workers? Sir, 49.82 lakh registered BD workers are there in this country. Now, for them, labour welfare scheme under Ministry of Labour and Employment is implemented across the country through labour welfare organizations situated in 18 regions across the country, including welfare of the BD workers and their families. What are the specific schemes which are being given for BD workers? The healthcare facilities through 10 hospitals and 279 dispensaries, reimbursement expenditure for specialized treatment. Sometimes it is now covered under cashless, paperless, but reimbursement also happens when they go for cancer treatment, when they go for tuberculosis, if they go for any heart diseases, or even for kidney transplantation. So their reimbursement method works. Financial assistance is also given for education of children of BD workers from class 1 to college or university, and the amount given ranges from 1,000 rupees to 25,000 rupees per student per annum, depending upon the class in which the child is or the course that the child is doing. Other than this, subsidy of 1.50 lakh per beneficiary for construction of a Pakka house is given under the revised integrated housing scheme, which commenced from 2016. RIHS has been converged with Pradhan Mantri Awas scheme. Other than this, of course, you have PM Shram Yogi Man Dhan, PMSYM, Suraksha Bima Yojana, Jeevan Jyoti Bima Yojana, Jan Arogya Yojana, public distribution system happens, Gramin Kaushal Yojana, and also the Swanidhi, Deen Dayal Antyodaya Yojana, and so on. So all these schemes also aim at the BD workers. Pramod Tiwariji again has mentioned that no mention of health and related expenditure is made here. I want to just highlight, sir, probably member Sagarika Ghosh also mentioned this. Health and wellness have been a key focus of our government. Prime Minister Narendra Modi has been very keen that in the last 11 years, I can read out the amount being spent on health. The Last year of UPA government, 2013-14, 33,278 crores have been spent for health ministry's budget allocation. Whereas 25-26 this year, the BE, I'm comparing the BE with BE, 99,858 crores have been allotted, 3 times more. So, other than that, between 2014 and 2021-22, 14-15 and 21-22, government health expenditure as a percentage of GDP rose from 1.13% to 1.84%. Government health and expenditure is a share of overall government spending also increased from 3.94 to 6.12%. Between 2014 and 22, per capita health spending tripled from 1,108 rupees to 3,169 rupees. This is per capita, sir. Other than that, of course, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana gives protection for nearly 55 crore beneficiaries, 9 crore plus, over 9 crore hospital admissions have been entertained under that, resulting in 1.3 lakh crore or even slightly more worth of free treatments. So healthcare has taken a good priority in this government. More than 16,000 Jan Aushadhi Kendras now present in almost all the districts of the country provide generic medicines at affordable prices, often 50 to 90% cheaper than the market rates. Then under the mission Indradhanush, 5.46 crore children and 1.32 crore pregnant women have been vaccinated against 12 diseases. This targeted initiative actually has contributed to a significant decline in the maternal mortality rate from 130 per lakh live births, that was in 2014 to 16, to 80 in 2020. So the last 11 years, sir, the government has approved or established several new aims across the country and in fact across several states, and set up also very many medical colleges, including the first ever AIIMS in the Northeast, located in Assam. MBBS seats have been increased to 1.18 lakh, and 74,000 PG seats have also been added since 2014. So tobacco products are being sold near schools. In Tamil Nadu was Sri Thambiduraiji, I can't see him here. He had observed it, but I need to say that there is an act from 2003, KOTPA, which is the Cigarette and Other Tobacco Products Act 2003. A provision has been made to prohibit the sale of tobacco products to an individual below 18 years, and this would apply to 100 yards around a school that it cannot be sold. Guidelines of the Tobacco-Free Education Institutions guidelines were also issued in 2019. So I would want to highlight to Honorable Member Thambidurai that GOI, Government of India, conducts tobacco-free youth campaign every year since 2023. Maybe greater awareness is required in Tamil Nadu. Sri Shivadasanji had raised this thing about lottery. I'm not sure I should be answering this here because this bill has nothing to do with the lottery system, sir, but he has raised it. I just want to highlight the fact, sir, that the 56th meeting of the GST Council, which was held this year on 3rd September, when the new generation GST decisions were made, which is much welcomed by everybody. The GST at that time had recommended, the Council had recommended, increasing the GST rate on supply of lottery tickets from 28% to 40. As I said, 28 doesn't exist anymore. Lottery cannot go to 18, so it went to 40. But of course, a delegation came and met me saying from Kerala, no, this will affect because a lot of people who are selling these tickets are poor people and so on. So this decision of the GST Council was unanimous. In Kerala, sir, the lottery is run by the state government. The supply happens within the state, and therefore there is no IGST also involved. It's all entirely state governments. And the SGST collected entirely is retained by the state. And 50% of the GST collected will go to the 41% will go from the CGST proceeding to the state. Now, it's a very considerate and very